Hello, everybody, and thank you for joining us for today's Ask the Expert session on Spina Bifida Occulta. We are very happy that you've all been able to join us. My name is Juanita Panliner. I'm with the Spina Bifida Association, and I manage the National Resource Center. And so this session is actually a follow-up to a session we had on November 17th of last year, a community information session about Spina Bifida Occulta. And then during that session, we weren't able to address all the questions that you had. And so we decided that we needed to do a follow-up, and that's why we're doing this Ask the Expert session. The November community information session was recorded, so you will be able to find the recording of it on the SBA website. So it's spinabifidassociation.org. And turning our attention to tonight's Ask the Expert, in addition to answering your questions, our expert, Dr. DiCiano, is going to review the Spina Bifida Occulta decision matrix that will help you find the right provider. Just a couple of housekeeping notes before we get started. We are recording the session. That way others who were not able to join us live will have access to the information that's being presented. And everyone who registered for the event will receive a link to the recording afterwards. And the recording will also be available, like I mentioned, just as the community information session was through the SBA website. We really appreciate all the questions that you submitted in advance, and we're going to do our best to fit them all in. For that reason, in the interest of time, so that we can get through as many questions as possible, we ask that you remain muted. And but please, if you have any questions that come up during the session, please go ahead, put them in the chat. Any comments that you have, put them in the chat as well. There were a few questions that we received that were not specifically related to Spina Bifida Occulta, but they're really important. So we're going to make sure that we reach out directly to those of you who asked those questions via the email address that you provided. And if you have any questions related to Spina Bifida Occulta or Spina Bifida, please do reach out to me at the National Resource Center. And now I'm very excited to introduce Dr. Brad DiCiano. Dr. DiCiano is the director of the UPMC Adult Spina Bifida Clinic. He's also the medical director of the UPMC Center for Assistive Technology, the medical director and COO of the Human Engineering Research Laboratories. He's also a professor, endowed research chair, and assistant dean for medical student research at the University of Pittsburgh School of Medicine. His clinical interests are in the areas of spina bifida and assistive technology. His research interests focus on developing and studying interventions that will help improve the health and wellness, particularly of individuals who have complex disabilities. But in addition to all that, Brad also serves as the Associate Medical Director for the Spina Bifida Association, and we are extremely grateful for his time today. So with that, I'd like to turn our attention to Dr. DiCiano.
Thank you so much, Juanita, and thank you all for being with me today. I hope that I can provide some information to you that will be helpful, help you find the right providers and treatment, and help you understand your condition a little bit better. As Juanita said, this is a follow-up to a session that we had back in November, so I would encourage you to go back and view that session as well. We had two experts that we talked about Spina Bifida Occulta. We had a neurosurgeon and we had a musculoskeletal spine specialist, and we talked about some of the background information that you need to know, and we covered as much as we could, but as you know, there's lots of questions. Spina Bifida Occulta can have confusing terminology, and so we decided to do a follow-up session today. I'll go through the key points of that talk and kind of address some of the questions that we weren't able to get to in that first session. So I'm going to just jump right ahead in, and I have a few visuals that I'm going to share with you today too to help you sort of navigate some of the questions that you might have. So first I want to talk about Spina Bifida and just give you some background so that you understand how we get to Spina Bifida Occulta, which is just a subsection or a small part of Spina Bifida as a whole. So when you're an embryo and you're forming, the embryo part of it is a tube-like structure. It's called the neural tube. And the neural tube is what forms your spinal cord and spinal column and your brain. And sometimes that neural tube does not close completely and form a complete tube. And so if that doesn't close completely, either on the spine part or on the brain part, it can cause what's called a neural tube defect. So there are a whole host of conditions out there that are neural tube defects, where there's a problem with the closure of that tube. Spina bifida is just one type of neural tube defect. So if the closure doesn't happen on the lower part of the spine, that causes spina bifida. And then there are different types of spina bifida beyond that. So sometimes people are born with an open lesion where the spinal cord and nerve roots are exposed to the outside. They're outside the body. It's an open lesion. And a lot of times when we hear the word spina bifida, that's what we're talking about. We're talking about myelomeningocele. That's the most severe type of spina bifida, and it's the most common open type. And that's not what we're going to talk about today. There are other types of spina bifida that are closed or occult. Occult means hidden. So that means that it's a closed lesion and you don't see those spinal elements outside the body. So today we're going to focus just on Spina Bifida Occulta, which is a type of spina bifida, which is a type of neural tube defect. So we'll jump right in. So how do people typically find out they have Spina Bifida Occulta? A lot of times we find it on an X-ray. And I brought a couple spine models here, and I want to point out some things so people understand some of the terminology that we're using. So I'm going to show you, this is a spine that is typical. So this is a spine model of somebody who does not have Spina Bifida or Spina Bifida Occulta. And there's different parts of the spinal column. So this is if the person is standing sideways, this is the front of the person, and this is the back of the person. So I'm going to rotate the back toward you. And what you can see is when you look down the person's back, these are the parts of the spine that you can often feel on your back. They feel like little buttons. These are the spinous processes of each arch of the spine. And then these are called lamina. These are parts of the bony structure that form a ring around the spinal cord. So the spinal cord is inside here, and it has roots that are coming off, but it sits inside a tube or a cylindrical structure. And when the bones are forming, like Dr. Bowman said in our previous talk, the bones form around like this and connect. And that's what you're seeing. Think of these as like the hands coming around and connecting at each level down the spinal column. Now, sometimes that doesn't finish. They don't connect correctly. So I'm going to show you a different model where one of my students was kind enough to cut some of the bone away so that you could see what happens if that bone doesn't connect correctly. So on this arch, you can see that it didn't meet properly. It left a gap. That should all be closed. So that's an area of Spina Bifida Occulta. And down here, this arch is completely missing. Look, if I compare it to this one, you can see that bottom arch is gone on this model. So this is where that arch didn't form at all. And so it's another example of Spina Bifida Occulta. So when we're talking about Spina Bifida Occulta, we're talking about the bone not forming correctly. Now, that is extremely common. So about 1 in 10 people have something like this on their spine. If you just X-ray 10 people, you're guaranteed to find about 1 just randomly that would have this. And it can affect up to 50% of children because these continue to form and complete as children grow. So we see this a lot in kids, and it doesn't mean that anything is wrong with those people. That is a completely common and normal finding in a lot of people. However, we also talk about spinal dysraphism. Sometimes when the bones don't form, you also have malformations of the spinal cord and nerve roots too. That's the yellow structure here inside this column. So if those are affected, that's when we get into the more complicated forms of Spina Bifida Occulta, where people have symptoms related to the problems with their nervous system. And so this can be really confusing. So what we did was we created a flow diagram or a flow chart to help people think about different parts of this. And it helps walk you through how to decide what symptoms you might have that could be related, what providers to see, what treatment you might need, and what workup you might need. So I'm going to go to that next, and we'll talk through the algorithm. All right, so this is available as a PDF. This is something we developed at the Spina Bifida Association, and it's called Finding the Right Provider. But it helps you learn a lot about your symptoms and how to not only find the right provider, but also work up in treatment. So what I want to point out here is that typically, most of the time, I want to get the highlighter here. Second. Okay. So one way that we typically find that people have Spina Bifida Occulta is if they've had an X-ray. It's usually found if a workup is being done, or sometimes it's found by accident because you have an X-ray for some other reason. So there are lots of people who have Spina Bifida Occulta, or that problem with the bones not forming, but they don't have any symptoms at all. They are what we would say is asymptomatic. So asymptomatic means you don't have any pain, you don't have any symptoms, you don't have any weakness or numbness, you're not having any problems at all. So if you're asymptomatic, you don't need any further workup or treatment at all, because this is very common. Like we said, this will affect 1 in 10 adults and about 50% of kids. And it doesn't mean that it needs anything to be done for it at all. Now, we get some questions about genetics. We've had some people ask, I have Spina Bifida Occulta, and I have a child who has Spina Bifida, like myelomeningocele, for example. Could there be a genetic link? And when we talk about genetics, typically, Spina Bifida doesn't have one particular cause to it. The reasons why somebody can get Spina Bifida are very complex. There are some genetic mutations that can put people at risk of having Spina Bifida, but that can also be altered by different types of factors of the environment or factors in the mother. There are medications, for example, or different maternal factors that can put you all at risk as well. And because Spina Bifida Occulta is so common, it's very common for any parent to have Spina Bifida Occulta. So 1 in 10 parents in general probably have Spina Bifida Occulta. So that doesn't mean that those are necessarily linked at all. We just find Spina Bifida Occulta in so many people, it's not necessarily genetically linked. Now, if somebody has Spina Bifida, like myelomeningocele, and then their child has myelomeningocele, that is a stronger association, and that's when we talk about folate supplementation in mom planning future pregnancies. But just to reiterate, there's a large groups of people who have Spina Bifida Occulta who, if they're not having any symptoms, nothing is required. There's no surgery, no treatment, nothing needs to be done. However, we know that a lot of people are having symptoms, and that's who we typically hear from at SBA. A lot of people say they have pain and they have problems, and they say, you know, this is such a tough situation, especially for adults, because people don't understand them and people think that they fall into this category, but that may not be true if you're having symptoms. So let's talk about another part of this flow diagram, what to do if you are having symptoms, because if you are having pain, then you do require some type of treatment and workup. So let's talk about the people who are symptomatic. Let's say you have an X-ray, they found Spina Bifida Occulta, and you're having some type of symptoms. What does that mean when we say symptoms? Well, these are the things that we're looking for. So we're talking about, let's say we have children, back pain in children, back pain in general would be something to look for in children. In adults, we're looking for back pain that's associated with other things, not just pure back pain. So back pain that occurs with leg pain or abnormal sensation in the legs. So that's like numbness, tingling, pins and needles type feelings. Weakness of the legs. And weakness of the legs can affect walking. That's what we mean by gait change, or decrease in stamina. So people are just having more problems walking. Scoliosis, or curvature of the spine. Changes in bowel or bladder functioning. So that means people that have back pain and also are having incontinence or urgency of their bladder, or multiple infections that are really puzzling the physician. And also people that have findings on the skin on the lower back. So this might mean a hairy patch, a fatty lump, a red or purple mark like a birthmark, a mark that is darker or lighter than the rest of the skin around it, or a hole or a tunnel. Sometimes we call it a dimple. So if the skin doesn't quite look right over that area, that's also a symptom. So these are all things that people might have noticed who also have Spina Bifida Occulta. So if that's the case, further workup is needed. So what is appropriate in this situation is an MRI of the low back. If you're having any of those symptoms and you know you have Spina Bifida Occulta from an X-ray, the recommended workup is an MRI of the low back. Now, in newborns and babies, sometimes spinal ultrasound is done, but an MRI can also be done in babies. But when we're talking about children and adults, typically an MRI is what would be indicated at that point. And why is that? Well, the reason is when we get an X-ray, all we can see are your bones. So all we're seeing really is whether you're missing bone or not. But what we're interested in here is, are there abnormalities with the spinal cord or nerve roots? Because whether or not there are abnormalities of what's inside the spinal column, not just the bone, but the spinal cord and nerve roots, that really determines what the proper treatment is and what the right type of provider is to see. And so let me go down a little bit further on our flow diagram here. And I'm going to go to the right first. So let's say we get this MRI of the low back and we find a normal spinal cord. The majority of people in this situation are going to have a normal spinal cord, but that doesn't mean that you don't have something in there that's wrong that's causing problems. You could still be having problems with the bones, the discs, or the soft tissue. And all of that requires treatment. It's just a different type of treatment. So in this case, the right type of provider to see would be a physiatrist. That's a rehab doctor. That's the type of physician I am. You could also see a musculoskeletal spine specialist. Some physiatrists specialize in this. There are also interventional spine specialists. These are physiatrists, or they are sometimes anesthesiologists, Pain specialists also can be physiatrists or anesthesiologists, and neurologists would also be a type of person you could see. So typically, when you have problems with the bones or the discs or the soft tissue, the treatments, there's a whole host of different types of treatment that may be appropriate here. And it really depends on where the problem is coming from. If the problem is just coming from the soft tissue, like the muscle, sometimes physical therapy is the type of treatment that is appropriate. Sometimes there's problems with discs. That can be treated with physical therapy. Sometimes it needs to be treated with different types of interventional injections. Sometimes people have questions about what they call steroid injections or spine injections. Depending on what's going on, that may be an option for treatment in this type of situation. And there's different medications that can be used. Sometimes lifestyle needs to be modified with weight loss and more exercise and physical activity. So there's a whole lot of treatments available. And what we have to remember is that people with spina bifida are people too, right? They get back problems just like everybody else. So sometimes people, and physicians especially, forget that somebody with spina bifida could have a disc problem or could have spinal stenosis. So we need to make sure that you're seeing the right type of physician to get the right diagnosis so that you can get the proper type of treatment. The majority of these treatments are non-surgical, but in severe cases, surgery might be required. So you maybe get referred to a surgeon if it's determined that the problem is surgical in nature. So that's what happens when we get an MRI and the spinal cord is normal. But now let's say we got an MRI in somebody and the spinal cord is not normal. Something developmentally did not form the spinal cord properly. And typically what we see is a tethered cord in this case. That's what we're looking for. We're looking for fat in the lower part of the spinal cord, or we're looking for what's called a low-lying conus. The conus is the bottom part of the spinal cord. And when it's tethered, it's pulled all the way down. So it sits very low. Usually it's, in an adult, it sits around the second lumbar vertebrae, the second vertebrae in the low back. But when it's tethered, it can be farther down near the bottom. So those are some things we're looking for on the MRI, because we can see all these structures with the MRI. We can see the soft tissue and we can see the spinal cord. If there's anything wrong with that spinal cord or nerve roots, a neurosurgeon is the person that you would want to see, because they could determine whether that needs to be surgically corrected. That's the first thing we have to decide is there a neurosurgery that needs to be done? And typically that needs to be done by somebody who's familiar with this type of spina bifida. Now, we got a question about how many people sort of fall into this category. And it's really hard to say, but out of all the people on this whole flow diagram, this is a small minority of people. So this is not a large number of people. We recognize a lot of people have symptoms, but a lot of people really fall into the category on the right, where they have bony abnormalities, but their pain is really coming from something else. It's not coming from their spinal cord. In this case, on the left, the pain could be coming from the spinal cord or the nerve roots. Just to give you an idea, if we talk about spina bifida as a condition overall, we say there's about 170,000 people in the United States living with spina bifida right now. That's maybe an underestimate, but about 20% or so, this is an estimate based on the National Spina Bifida Patient Registry, which may not represent everybody in the whole United States, but just as a rough estimate, about 20% of people with all types of spina bifida have more of the occult type lesions, which is what we're talking about on the left side of this diagram here. So that would be about 33,000 people in the United States, just approximately. So that gives you just some approximate numbers of what we're looking at here. Another question we got is about success rates for surgery for when this is happening. So if you're found to have a tethered cord, what can you expect from surgery? And that's a hard question to answer because surgical success rates depend on a lot of things, including the physician who's doing it and where it's done, and multiple factors related to the patient, like other problems that they may be having. So it's hard to say, what the outcomes of the surgery would necessarily be for a particular person without knowing more about them. But I think it's more important to ask the question, when is surgery indicated? And that is something that is based on symptoms. It's based on how fast your symptoms are progressing. And it's something that's worth a discussion with the neurosurgeon about. They can go over the risks and benefits and help you make the decision about whether that surgery would be appropriate or not. And you can read more about tethered cord in our Spina Bifida guidelines. So the guidelines for the care of people with Spina Bifida, the neurosurgery section has a section on indications for treating tethered cord. You'll also have to remember that people with myelomeningocele get tethered cord. And that's not what we're talking about today. Remember, we're talking about the closed lesions, and myelomeningocele is one of the open types of Spina Bifida. And that's, we're not talking about cord related to myelomeningocele in this particular talk. Another question that we get a lot is, if I do have a tethered cord, are there physical activities or things that I should be doing, or are there things that I shouldn't be doing? And there aren't necessarily absolute restrictions of things that you cannot do. You have to be very mindful of your pain and your symptoms, and sometimes you need to limit your activity if you're becoming real symptomatic or you have a lot of pain with a particular activity. A lot of people will tell us that a lot of pressure on their back or flexing the spine, so like bending forward, people will say that sometimes causes a lot of pain. So you have to be really mindful of those types of positions. But in general, we want people to remain physically active. That's very good for you, for your health, for your muscles. And you can lose strength if you start to become less active. So we encourage physical activity, and we just need people to be mindful of what limits they have in terms of pain. So I'm going to stop sharing the protocol here and see if I can jump into maybe some of the other questions that people might have. I answered some of the big ones that pop up, but I'm wondering if other folks here in the session have questions that they want to ask.
And we have a question that says, if you have the spinal cord abnormality with symptoms, what other doctors might you need to see?
Yes, so if you have, if you've had an MRI and the spinal cord is abnormal, it's very important first, like I said, to see a neurosurgeon. But that's a good question. What other doctors besides a neurosurgeon might you need? It's possible one of the ones that would be top of the list might be a urologist if you're having bladder problems. Sometimes a rehab doctor or physiatrist is also involved if you have pain or mobility issues. Sometimes orthopedic surgeons if you have other abnormalities like scoliosis or problems with your the bones of your feet or ankles. Those would be some examples of some other specialists that these folks typically see.
Thank you. And I actually had just one quick follow-up question, just based on questions that I get with the National Resource Center from people who have been diagnosed with SBO and are symptomatic. They're feeling pain, and they want to know, like, can I still work at my job where I do a lot of heavy lifting? Like, how do they decide what to do in the future?
Yeah, that's a great question. So, there are, first, you need to find out if the symptoms that you're having are treatable, so I would recommend this sort of thought process to find the right workup. Do you need an MRI? If so, depending on the findings, what kind of treatment you might need. Because first and foremost, you want to treat any problem that you might be having. A physiatrist is a good type of physician to see if you have questions about work. There are different types of assessments that we can do to measure your capacity to work. One of those things is called a functional capacity evaluation. And we can work with a physical therapist to really go through a lot of testing and maneuvers to figure out what you're capable of doing and what would be safe. And sometimes that involves a lot of training on, if you're somebody that, like, let's say, lifts boxes as part of your job, we can do a lot of training on how to do that safely and what your limits might be.
Thank you. And there was actually a follow-up question. If the spinal parts of the bones are closed, but they still have the tethered cord with symptoms, is it still considered SBO?
That's a great question. So again, remember, when we're talking about Spina Bifida Occulta, we generally mean the bony part. So people with abnormal spinal cords and people with normal spinal cord may both have Spina Bifida Occulta, because what we're talking about is the bony abnormalities. Technically, when we get to the problems that affect the spinal cord, sometimes we call that spinal dysraphism. You may see that. That's more of a scientific term. Or we might just call it tethered cord, a lipoma, lipomyelomyingocele. There are different other terminologies as well that talk about the spinal cord itself. But yes, people with SBO may have spinal cord abnormalities. The majority of people with SBO do not have spinal cord abnormalities. They're just missing bone.
Thank you. And what do doctors think of sacral neuromodulation for people with a tethered cord and bowel issues?
Yeah, that's still investigational. So there is some thought that using electrical stimulation on the lower parts of the spine potentially has some role in treatment and regulating the spinal cord dysfunction. I will say that it's still very early in research to really say whether it has an effect or not. Most of the research that's being done is in spinal cord injury, which is different in some ways than spina bifida. And when it has been done in some small studies in spina bifida, the majority of patients have not had this Spina Bifida Occulta types. It's more been myelomyingocele. So the answer to that is that the jury's still out. We're still doing research on that, and we can't say one way or the other.
What about hydrocephalus in Spina Bifida Occulta?
Hydrocephalus is primarily not seen with Spina Bifida Occulta. Generally, the majority of people with myelomyingocele or the open type of Spina Bifida are generally the ones that are more likely to have hydrocephalus and need a shunt.
And is Currarino syndrome considered SBO as well? And maybe if you know what it is, could you, just for those who might not know what Currarino syndrome is?
That's a new term to me, so I will have to research that, and we'll have to answer that one online. I don't recognize that syndrome. There are lots of syndromes where there are abnormalities of the formation of the spinal column along with other abnormalities. There's lots and lots of genetic syndromes, and so we do see Spina Bifida Occulta and some different syndromes as well.
And does SBO affect your bones, for example, causing your feet or ankles to turn inward?
So remember, when we're talking about Spina Bifida Occulta, we're talking about the bones of the spinal column. So we're talking about the bones of the back being missing. So that in and of itself does not cause any problems. Now, if you have spinal dysraphism or a tethered cord or problems with your spinal cord, the nervous system, that can cause problems with your legs. So it can cause weakness, numbness, can cause other findings in your legs. And so some people may notice some problems with their feet or ankles because of problems with their nervous system, not because they have missing bone up in their back.
Okay. And what is the difference between lipomyelomyingocele and lipomeningocele?
That's a terrific question, because a lot of physicians actually use those terms interchangeably. But technically, I'll tell you what the pieces of the words mean. Lipo means fat. So any word that has lipo in it generally means there's a lipoma or fatty part inside the spinal cord. So when you think about the embryo forming, there's different layers of the embryo that form the muscle and the bone and the fat. And sometimes that fat gets into the wrong layer. It can developmentally be in the spinal canal. So that's the lipo part. The meningo part is the meninges, or that's the covering of the spinal canal. So sometimes when there's a pouch, it's made out of meninges, or the coverings of the spinal canal. And cele means pouch. And myelo means spinal cord or nerve roots. So somebody with lipo, myelo, meningocele would have a pouch that is made out of meninges, it has nerve roots in it, and it has fat. Lipomeningocele has fat, meninges, and a pouch, but doesn't have the myelo part, so it doesn't have the spinal cord or nerve roots as involved as the other term.
So is it safe to have pain treated with a steroid injection if the spinal cord is split and tethered?
Great question. So some people do require spinal injections for different reasons. However, if the anatomy isn't typical, if the spinal cord is split, so obviously the anatomy of the spinal cord is different, and if it's tethered, sometimes it sits lower down than normal. And so sometimes it might not be safe to put the needle in the spinal column if there's a chance that the spinal cord could be punctured. There are ways to do spinal injections safely through what we call fluoroscopy. So there are X-ray machines that can help you guide the needle, but you have to have somebody who really knows what they're doing. And really you have to decide ahead of time, whether that's the right treatment. You have to talk about whether the approach is safe. So it requires a big evaluation to really determine if that's something that's possible for each particular person. It may be different depending on what's going on with their spine.
And so another comment is, I have tethering. I also have a split spinal cord. The split has a bone spur in it. What issues can result from these symptoms?
So sometimes we can see a lot of abnormalities around the spinal cord, bone spurs in particular. Those can happen in people with spina bifida and people without spina bifida. It's an overgrowth of bone that sometimes can press on things. So the bone can kind of grow and in areas where it shouldn't be. So it can press on if it's inside the canal, it can press on the spinal cord itself, or sometimes bone spurs can press on the nerve roots where they're coming out the spine. So that can cause, again, if you're causing problems with the spinal cord or nervous system, it can cause weakness, numbness, pain, bowel and bladder problems, depending on where it is. A lot of the symptoms that are on the flow diagram here can be related to that when the nervous system is involved.
Yeah, thank you. And is idiopathic intracranial hypertension common with SBO?
That is not common. So the majority of people with Spina Bifida Occulta, again, are the vast majority of Spina Bifida Occulta have no symptoms at all and no problems. Of the people who have abnormalities with their spinal column, their spinal cord or spinal nerve roots, that is not associated with intracranial problems typically.
Okay, and what about levoscoliosis, snapping hip? Are they symptoms of SBO?
So the scoliosis can be a symptom of tethered cord. So again, if you look at that flow diagram, scoliosis is on the list of one of the things that would prompt you to get an MRI of the spine to see if there is a problem with the spinal cord. Although there are people with scoliosis who don't have problems with the spinal cord. The snapping of the hip is complicated. There's lots of things that can cause that. So It can be a hip issue, but sometimes you can have hip issues because you have weakness that's from the spinal cord being involved. So that's a hard one to say. So that's something that needs to be more fully evaluated and worked out.
And I just out of curiosity, actually, just thinking about this, so because it needs more evaluation, and it's, I guess what I heard was it's not necessarily related to SBO. Like who what kind of a provider should this person be seeing?
So again, we'd want to find out what type of SBO this person has. So we would need an MRI if they have a problem with the spinal cord or nerve roots. That first want to see a neurosurgeon, and then because it's a hip issue, they might pull into other providers like a physiatrist or orthopedic surgeon. However, if the person had an MRI and there was no problem with the spinal cord, they were just having some scoliosis and hip and the snapping hip, and they probably a good provider to start with would be a physiatrist or even an orthopedic surgeon in this case.
Okay, thank you. And then there was a question about, do we know what percent of Spina Bifida Occulta is found incidentally?
So the vast majority, there's millions of people with Spina Bifida Occulta. As we said at the beginning, 1 in 10 adults has Spina Bifida Occulta, and about 50% of kids until they grow and their bones fuse have Spina Bifida Occulta. So the vast majority of people, we just see it and it doesn't cause any problems. It doesn't need any treatment.
And do we know a percent of a total that causes clinically significant morbidity?
Yeah, again, we'll go back to what I was saying about the different types of Spina Bifida. The types of Spina Bifida that causes symptoms. We have the vast majority of people who are symptomatic. A large group of those people are going to have the myelomeningocele type, and then about 20% or so fall into the category of people with Spina Bifida Occulta who have problems with the nervous system that are things like tethered cord and lipomas and so forth.
And then what about, do we have a sense of the percent or the number that requires surgical correction?
That's I can't give you exact numbers on that. When these are found, a lot of these are found when you're a child, very early on. And so a lot of those folks have some type of surgical correction if there is a tethered cord or lipoma or so forth. But there are some that, are found later in life, and they may or may not require surgery, just depending on the complexity and the symptoms.
Okay, great. Now, what about deterioration? What can a person with tethered cord do to slow it down, particularly when it comes to strength in the legs, sensation, bowel and bladder problems?
Yeah, so remember, if you have a tethered cord, and here in this case, we're talking about tethered cord in the setting of Spina Bifida Occulta, there's nothing that you can do that's going to affect the spinal cord itself, right? We want you to remain active. We want you to, be able to exercise and have some physical activity within your limits, pay attention to the pain that you're having and what limits that you have. We don't put specific restrictions on what you're allowed and not allowed to do with your spine. But it's really important to keep your muscles moving and active so that you don't lose strength. So physical activity is important. Sometimes you may need physical therapy. And then, of course, if you're having other symptoms like bowel or bladder problems, we need to treat those. So you may need a physiatrist or a urologist or other specialists to treat those problems as well. If it's progressing and your symptoms are getting worse, you need to see a neurosurgeon for that.
Okay, and then we have a question about how common is cervical SBO and what would be the difference in symptoms?
So cervical problems are less common because of the way the embryo forms. It usually, if it doesn't finish, it's usually more towards the lower part of the spine, but that doesn't mean that you can't have it on other parts of the spine. So it's much less common to have it in higher parts of the spine. If you do have problems with just the bones, again, it's not going to cause any symptoms. But if the spinal cord or nerve roots are involved as well, and it's high up, if it's in the cervical part or the neck, then it could affect the arms.
Very good. Thank you. Well, I don't see any extra questions here, but we have in the past have gotten other questions, many other questions, and one of them, and a lot of them really have to do with pain. And so, you've explained, Dr. DiCiano, that it really depends on what it is that you have. But for people that are having pain that, it's just not being addressed by their providers, like what could you say to them to help them out?
Yeah, the first thing I would say is that pain is real, right? It's something that needs to be addressed and needs to be treated. And so we need to get people plugged in with a provider who will listen and do the right type of workup. I think people, especially adults with this condition, get very frustrated because they feel like physicians blow them off. And if they find out that they have Spina Bifida Occulta, some physicians just think, well, then they're not having any problems. And we talked about how a lot of people with Spina Bifida Occulta are asymptomatic, but if you're having symptoms, that means you fall on the other side of this flow diagram. So you do need a further workup to determine, where that pain is coming from. It might be related to your spina bifida. You might have a tethered cord, but in a lot of cases, these people don't. They have real pain, but it's pain coming from something else. But that something else needs to be identified. Is it a disc? Is it the facet joint? Is it spinal stenosis? All of those things have real treatments available. It's just that people, I think, sometimes get caught in our healthcare system, not finding the right providers, not getting the right treatment, and then they get frustrated because they have this chronic pain. So that's why we created this flow chart to help people sort of advocate for themselves. That helps you understand your symptoms, what type of testing you might need, and then what kind of providers you might need to find. And if you need help finding those providers, contact the National Resource Center. You can tell us where you live and we can give you recommendations about providers in your area that you may be able to see to help you.
And so, right. And so like some of the questions we've had before, and I think you've pretty much answered this as well, is then what about SBO and migraines? Sometimes we get that a lot, and is there a connection there? Or again, it just, you have to find the right doctor.
Yeah, I mean, people think that SBO is related to a lot of things because SBO is very common, and there are lots of things that are common, like back pain, like headaches. Just because they're happening in the same person doesn't mean that they're necessarily related. So it's really important to get a full workup to find out, what type of SBO do you have, and what are some of the complications with it. Like we said, the majority of people with Spina Bifida Occulta do not have hydrocephalus or need a shunt. It's different than the myelomeningocele type of Spina Bifida.
And we have a question, and there are no weird questions, but is it possible that your tethered spinal cord can snap by doing physical activity?
So we don't want people to be worried about exercise or physical activity, thinking that you can damage your spinal cord. Again, you have to be very careful about your symptoms. So pay attention to your body and don't push yourself past the limit that you don't think that you can do. We like to encourage people to remain active.
Okay, thank you very much. And can SBO cause high pressure spinal fluid?
Well, there can be if you have an abnormality of the formation of the spinal canal and you have problems with the spinal cord and spinal nerve roots, not just problems with the bones, there can be abnormal CSF flow, right? Cerebral spinal fluid flow in the canal because it's developmentally isn't formed typically. So there can be abnormalities in that. Depending on whether that causes symptoms or not, that can be really variable.
And are there any sports activities my toddler with a surgically repaired tethered cord should avoid? Skiing, hockey?
Yeah, again, there's no absolute restrictions on what people can and can't do if they've had a tethered cord. But again, we say that, just be very mindful of your body. And so with a toddler, you don't want to monitor symptoms very closely, try to gradually get into activities to test out what the child can tolerate, and it would be good to consult, a neurosurgeon and even a physiatrist or a rehab doctor to give you some guidance, because every person can be a little bit different. So there may be some certain things about the child that need to be taken into consideration, but the general rule, which we follow, is, be active within the limits of what you can do.
And what about a relationship between SBO and neuropathy?
Neuropathy is another complicated term. Neuropathy means a problem with the nerves themselves. Usually when we say neuropathy, it means we're thinking of something like diabetes that damages the nerves themselves. And with neuropathies, it's damaging the nerves in the legs or in the arms. So in some senses, if the nervous system is malformed and the nerves are affected, in some senses of the term, it can be a neuropathy in a way, but the problem is coming in that case from the spinal cord itself. It's coming from the central nervous system. A lot of neuropathies do not involve the spinal cord or central nervous system. A lot of neuropathies are just caused by problems with the nerves outside in the arms and legs. So there's lots of different types of neuropathies out there. So that's kind of like a big blanket term for a lot of different things.
And what are the risks of a second untethering if the first operation had a lot of complications like brain fluid leakage from the wound? When is it recommended to do a second untethering?
So that's a very specific question that I can't answer because it depends on you as the person, as the patient, right? This is something that needs to be discussed with the neurosurgeon. Risks of surgery depend on a lot of things. The anatomy, other health conditions of the person, the situation that happened in the first surgery, there's lots of things to discuss. So I can't answer that. That's something a neurosurgeon would have to evaluate you and give you that answer for your specific case.
And then another thing that comes up sometimes is, for people with SBO, they've been diagnosed as having SBO, and then they also report that even before the diagnosis, they were feeling all kinds of like different types of bowel and bladder change. For those people that are experiencing that, and then they get the SBO diagnosis, would they then see the same type of urologist, for example, that also specializes in seeing people with spina bifida, like the myelomeningocele with the open lesion?
Yeah, so if you're having symptoms like bowel or bladder problems, you would need to get an MRI really to tell us whether that's, whether there's an issue with the spinal cord or not. If there is a problem with the spinal cord, then first you should see a neurosurgeon, but we might need to pull in some other specialists as well, like urologists or physiatrists to help manage those problems. So it does end up sometimes being the same kinds of providers that other people with spina bifida might see, but you really need the right type of workup to direct you to the right type of provider. The big question here, I like to think of Spina Bifida Occulta as being a very vague term. If somebody says, I have Spina Bifida Occulta, the next question would be, well, what kind, right? We need to know, is the spinal cord involved or not, really, to be able to direct you to the right types of treatment. It's similar in some ways to saying, like, I have heart disease, right? The types of treatment that somebody might need for heart disease depends on what problem they have. Do they have congestive heart failure? Do they have a blocked artery? Do they need a heart surgeon? Do they need a cardiologist? Or do they need cardiac rehab? It really depends on that additional information. So think of Spina Bifida Occulta as being a very vague term, meaning we need more information. We need to figure out what's really going on here.
Thank you. And is it common for people with SBO to have multiple sclerosis?
So this is another question that we get a lot, where like I said, we get a lot of questions about, like, is SBO related to something else? And in this case, there's no direct relationship between the two. It's just that MS is, fairly common. Spina Bifida Occulta is extremely common. It's going to be very probable to see people with lots of different conditions who also have SBO.
And so if you have tethered cord, is there anything in the context of this session, tethered cord with Spina Bifida Occulta, is there anything a surgeon needs to know before a knee surgery, for example, like any concern and also concerns for colonoscopy for someone with neurogenic bowel and bladder?
Yeah, this is a great question, because a surgeon should always be informed if you have tethered cord. It can affect things like how you are positioned on the operating table. That needs to be something that's talked about and planned. We recommend this for gynecologists as well. If you're somebody that has a tethered cord and you can't tolerate certain positions, that could affect a pelvic exam during a gynecologic exam, for example. So those are all things that you should talk with your providers about and think about them and plan them before you have a procedure. People with neurogenic bowel often have difficulty with preps for colonoscopies. And so, that's also something that has to be planned out. When you take a lot of the medications that people typically take to clean out their bowels for a colonoscopy, you can have a lot of incontinence, a lot of issues that are hard to manage. And so a GI specialist who's familiar with treating somebody with neurogenic bowel can be very helpful. There are actually neurogastroenterologists. They tend to be a little harder to find. They're more specialized, but there are GI doctors that take care of people who have GI problems because of nervous system problems. And that can be a very good specialist to see for this type of issue. Similar with bladder, there are urologists and there are also neurourologists, people that are trained to manage the bladder in the setting of having a nervous system condition.
And we're almost out of time, but we had another question that asks, how many kinds of SBO are there? So, and then in parentheses, we've got lipomyelomenogenesis and lipomeningeal.
Yeah, so we listed a few, what we're really looking for when we're doing the MRI. Some of those are on the spreadsheet, the flow diagram that you can look at. We're looking for a tethered cord. We're looking for lipomyelomenogenesis or lipomeningeal, like you have listed there. We're looking for a fatty phylum. Those are the ones that you'll probably most typically encounter, but there can be lots of different variations there. So again, remember, when we're talking about Spina Bifida Occulta, that's specifically, we're talking about the bone. In this case, we're talking about the problems with the spinal cord or nerve roots, and that's more the spinal dysraphism or the problems with the nervous system.
And I apologize in advance for messing up this question, but what if the lipomyelomenogenesis grows until completely blocking the flow of the fluid, liquor, cerebrospinalis?
I think they're asking, if there's some changes in there where the fatty tissue is changing, or maybe there's sometimes a sort of a pouch-like structure in there that can change. That can cause symptoms. Again, if you're having symptoms, that needs to be evaluated with imaging to determine whether you need to see a neurosurgeon.
Okay. And then I think we have time for this one more. And is the appearance of a sacral dimple or one buttock higher than the other an automatic indicator of SBO?
So the lower part of the low back by nature has some dimples in it. So just because there's a dimple there doesn't mean that you necessarily have Spina Bifida Occulta, but it can be an indicator. So that's one of the things on the flow diagram. If there's changes on the skin or the low back, that could be one of the indicators that might prompt a workup that needs to be done.
Okay, very good. Well, thank you so much to everybody for all your questions. Thank you so much, Dr. DeCiano, for taking the time to do this. Really, really important. And I just have to say, I just love the I just love the two models of the spine. I thought that was extremely helpful.
I just wanted to say thank you to everyone for attending. And, this is a really important topic. The reason we did this session was because we hear this is important to you as a community. If you really care about this issue and you want more resources for people with SBO or for adults, reach out to us at SBA, get involved. There's lots of things that you can do with advocacy and fundraising and things that will help us, continue to do sessions like this to help the community.
Well, thank you so much. And just, keep on the lookout for the recording of the session on the Spina Bifida Association.org website.
Thanks, everybody.
Thank you. Bye-bye.